Good morning, everybody. My name is Mark Tucker. I'm part of the NHS England NHS Improvement Learning Disability and Autism Programme, and also one of the special educational needs and disabilities leads across the Southwest. So I'm very excited to be here today. I'm just making sure my slides are working through okay. Yep, they are. That's good. I'm very excited to be here, and I'd like to welcome you to the Positive Behavioural Support Conference that we have on today. This is the end point of a project for us, which has been going on for the last year, which has involved a range of training across the Southwest, which has been looking at trying to support the development of positive behavioural support into areas that maybe have not always adopted positive behavioural support. So we've gone for a range of training and support, both within sort of community settings, so community support providers, but also into community teams, all areas where positive behavioural support is much more of a norm, but also looking at focusing on children's mental health teams, adult mental health community teams, and also inpatient teams as well. So mental health inpatient teams. So it's been a real range, and the training has gone on this year throughout COVID. So it's been a real challenge and a lot of adaptation by the team who's put it on, and massive thank yous for them about that. With the main aim of trying to ensure that positive behavioural support becomes a mainstay of what we're trying to achieve across the Southwest, a level of consistency, a level of support, and a value base that we can all sign up to. And what I want to do now is just give you a little bit of an understanding of what we are doing and why we have supported the positive behavioural support and supporting this conference today. And that is really around the learning disability and autism programme. It's focused on the NHS long-term plan, and and also have to put a quick plug in here for us, because it's not actually NHS England Improvement that's funding it, it's Health Education England, and they've enabled us to do this piece of work today. But what I want to do now is just give you a bit of a basis of where we are and what we're trying to do across the Southwest. Now, for some of you, you may well be aware of the abuse scandal at Winterbourne View, which enabled us to pull together a strategy which was firstly the Winterbourne View strategy, then became Transforming Care, is now part of the Learning Disability and Autism Programme. And that programme is very much focused still on reducing the number of people in a hospital setting. And that's a number of both children and adults in a hospital setting who have a learning disability or autism. And we know we still have too many people across the Southwest. At the moment, we know approximately we have 168 adults and 19 children across a range of local inpatient settings and secure settings. So we still know that we have to do a lot, and we know that we can't do that without building up the support within the community, and positive behavioural support is part of that pathway of support for individuals. So let's have a little look at that and what we've committed to within the NHS long-term plan. As I say, the NHS long-term plan does focus us around reducing the need for mental health inpatient admissions, and I'll talk you through what we're doing there in a minute. It also looks at discharging, how we can discharge those people with who are in hospital at the moment. And over the next year or so, we are going to be focusing down on people who have been in hospital for over 2 years. And when we look at the, if we go back up, oh no, going the wrong way, sorry, going back up, they say those 168, we know the majority of those individuals there, there's a core of individuals who have been in hospital for over a 2-year period, and we need to look at how we can build up community infrastructure and support around individuals so that we can safely support them in a community setting. The other thing that we need to do as well, and this is where PBS is great, is look at how we support reasonable adjustments within mainstream health and social care services. And that's why we rolled out the training to to mental health teams, inpatient services as well. So widening out the ability of teams across health and social care to support people in a consistent way, which has been absolutely fantastic, and we've been really impressed by the way that people have signed up to the training. And we know that we also need to build up community infrastructure. So let's have a talk about the community infrastructure. Over the next couple of years, we're going to be building on a community infrastructure. We are going to build up intensive support services, 7-day-a-week intensive support and crisis and forensic community support. We are also going to be looking at building up more community housing and support options for people who are in hospital at the moment, but also looking at preventative housing options like crash pads and things like that. So again, seeing PBS work through all that as a core part of staff's training, individuals training, family members training as well. And we want to move to reduce preventable admissions as well. And again, we need to look at the fundamental process, the structures in place there. And we know that we still need to build up community teams for adults, children and young people, to reduce hospitalizations. And that's thinking very much around looking at teams for children and adults with autism, and children and adults with learning disabilities, and building up the capacity within those teams to support in prevention, crisis intervention, and ongoing support of people with complex needs. So there's lots of exciting stuff going on. So we will be, and we are at the moment, building up on housing and support options. We're looking at building up smaller providers across the southwest. We're looking at regional approaches to supporting people moving out of hospital. We're looking at bringing people back in who are currently in hospitals out of area, so out of the southwest, and looking at setting up community, and in some cases some small hospital options. Embedded in that whole approach, though, is a view around human rights. And we want to keep it very much a human rights perspective. Our value base around this is very strong, looking at the needs of the individual, keeping the person at the heart of what we do. So human rights is there, person-centered planning approaches is there, and behavioural support is fundamentally there in what we're trying to do. And we will be looking very much at preventative strategies, which is something which PBS stands for all the way through. And again, that philosophy of change within mainstream health and social care and education services. And if we can push positive behavioural support as an approach there, I think we stand in good stead of ensuring that people, where possible, don't end up in a mental health inpatient setting where they don't need to be, and also that we can support those people moving out. So I think you probably pretty much heard enough from me now, but I just want to say a few things before we crack into the day and we hand over to Hannah and Tia. Firstly, as I said at the beginning, this is the end of a year-long piece of work. It is not the end of what we're trying to do in the southwest around positive behavioural support, though. It is very much a continuation, and we would really welcome you feeding through in the sessions today about what you think we now need to do to support the rollout of consistent positive behavioural support across the southwest. And this is an important moment, I think. And you've got over 1,000 people calling into the various sessions that we're having today. So there's a lot of influence, and and it's really exciting to see the buzz around what we are doing with regard to positive behavioural support. But I do need you now to think about what we can do next. Feed it into us soon, so we can start making those next steps on the journey. But I would just like to say a few thank yous to people for this last year and the conference today, and I would really like to say a big thank you to the PBS UK and PBS 4 team, but specifically to Tia, who has managed to coordinate the project, whilst being heavily pregnant and holding a little one in arm as well, but also for Hannah and Paddy rolling out the training, and also to Angela from NHSE who's coordinated us all together to make this happen. So, but lastly, to say thank you for everybody that's attending today, and thank you for those that have done the training, and I look forward to hearing about your feedback. And one last bit that we need to do as well is we've the PBS UK team asked us to have a look at some of the great work that's going on across the country. We had a short list of 3 individuals that are doing some fantastic work around positive behavioural support, and we were able in the end to whittle the 3 down to 1 as a brilliant example of practice. And that gentleman works in Norfolk and has been part of the PBS team in Norfolk, rolling out PBS in their area. And that's Tom Bassett, and he is going to be on at 1:30 today, talking about what he has done, and just to acknowledge him as a fantastic practitioner, and thank you for all that you've done for positive behavioural support and raising the profile of positive behavioural support. But I think that's probably enough from me now, and I'm going to hand over to Hannah and Tia for the next stage.